Hey everyone, welcome to our deep dive today. We're going to be tackling a pretty big topic, depression. And we're not just skimming the surface here. We've
Yeah.
got these in-depth standard treatment guidelines from India, and they are dense.
Yeah.
So we're going to break them down, make it easy to understand, get to the good stuff, right?
Exactly.
What I found fascinating, and maybe you will too, is how these guidelines don't just define depression.
Right.
They categorize it by severity.
Wow.
And then they lay out specific treatments for each level.
Yeah, it's almost like a roadmap
It is.
for healthcare providers
Yeah,
to choose the best approach for each person.
it is a roadmap. Okay, so we all know what it's like to feel sad sometimes.
Yeah.
But these guidelines, they actually lay out specific criteria to diagnose clinical depression. Like, when is it more than just feeling down?
Right. It's not just a mood, It's a whole cluster of symptoms.
Okay.
You might lose interest in things you used to enjoy
Yeah.
or have this constant fatigue. Even physical aches and pains that don't have a clear cause.
So it's not just a bad day.
No, it's much more than that.
These guidelines talk about different levels. Mild,
Oh,
moderate,
yeah.
severe. And some of the examples in the guidelines, I mean, they really jumped out at me, like feeling hopeless about the future,
Right.
or even having thoughts of self-harm. I mean, that's heavy stuff.
Yeah, those are some serious red flags
Yeah.
that distinguish clinical depression
Yeah,
from just feeling down.
right.
And those specific symptoms, they're crucial because they help determine the severity and urgency of treatment.
Okay, so let's say you're listening and you're like, maybe this is more than just a rough patch. How do you know when it's time to actually suspect depression?
Well, the guidelines actually lay out these different situations as simple versus difficult cases.
Okay.
Simple cases might involve noticeable mood changes that could improve with initial support
Mm-hmm.
or maybe lifestyle adjustments. But difficult cases,
Yeah.
those are marked by some serious signs like suicidal thoughts, substance abuse.
Right.
These situations require immediate and specialized care.
Makes sense. So once someone recognizes they might be dealing with depression, what's next? What does treatment actually look like?
That's where this choose-your-own-adventure aspect of the guidelines really comes in.
Oh, I like that.
They outline these different levels of care: primary,
Okay.
secondary,
Yeah.
tertiary, with increasingly specialized treatment options based on how severe the depression is.
So it's not a one-size-fits-all approach, which makes sense. I was reading about the different classes of drugs mentioned in the guidelines: tricyclics, SSRIs,
Right.
even MAOIs. Are these all basically doing the same thing, just different brands?
Not exactly. They are all antidepressants, but they work in slightly different ways on your brain chemistry.
Okay.
For example, SSRIs are often preferred because they specifically target serotonin, and that can mean fewer side effects compared to the older medications, like tricyclics.
Oh, interesting. So finding the right medication is kind of a journey then.
It can be, yeah.
Okay.
And that's why it's so crucial to work closely with your doctor to find what works best for you. But remember, medication isn't the only answer. The guidelines place a really strong emphasis on psychotherapy, especially for more complex cases.
So why is therapy so important? Especially if medication can help with, the chemical side of things?
Because therapy helps you tackle the root causes of the depression.
Okay.
It gives you coping mechanisms,
Yeah.
helps you address underlying issues, and it can be incredibly powerful when combined with medication,
Right.
especially for those difficult cases we talked about earlier.
Makes sense. So we've gone from recognizing depression to understanding its levels
Right.
and treatment options. What else stood out to you in these guidelines? What should our listeners really take away?
The insights they provide into depression in India specifically,
Yeah.
they actually share some statistics showing that depression is a significant health concern in the country.
Okay.
And they emphasize this really important concept called differential diagnosis,
Yeah.
which means ruling out other conditions that could mimic depression. You might be surprised to know that, for instance, thyroid issues or even nutritional deficiencies can sometimes look like depression.
Wow. So it's like detective work,
Uh-huh.
making sure you're treating the right problem. What else is important for people to understand about depression?
The guidelines highlight that depression often doesn't travel alone.
Okay.
It can appear alongside other mental health conditions,
Okay.
like anxiety
Right.
or personality disorders. This is called comorbidity.
Okay.
And it means treatment needs to address all the pieces of the puzzle, not just the depression itself.
So it gets more complicated.
It does, yeah.
Okay. Well, we've laid some groundwork. Now let's unpack the specific criteria these guidelines use to diagnose a depressive episode. These actually use the ICD-10 criteria, right?
They do, yeah.
Okay.
And you might be surprised how relatable some of these criteria are. It's not just medical jargon.
Right.
It's about real-life experiences.
Okay, so where do these criteria even begin?
Well, according to the ICD-10, some of the first symptoms you might experience are persistent low mood, losing interest in things you used to love,
Yeah.
and this constant feeling of being drained.
Mm-hmm.
Have you ever felt so exhausted that even simple tasks feel overwhelming?
I mean, I think a lot of people can relate to that,
Yeah.
especially in, our busy world these days.
Right, and that's just the beginning.
Yeah.
Depression can affect your thinking
Yeah.
and emotions, too.
Okay.
You might struggle to concentrate or deal with low self-esteem
Right.
and even feel excessive guilt
Yeah.
or self-reproach. It can really color how you see yourself in the world.
That's a good point. It's not just about feeling sad.
No.
It affects your whole outlook. And this is where those more severe symptoms come in, the ones we mentioned before.
Exactly. As depression progresses,
Yeah.
you might start to have these bleak or pessimistic views of the future.
Right.
Thoughts of self-harm
Yeah.
or even suicidal thoughts. These are really serious signs.
Right.
That professional help is needed urgently.
So it's like a spectrum, right?
It is.
From feeling down to experiencing these really intense, distressing thoughts. And the ICD-10, it breaks that down into like mild, moderate, and severe categories.
That's right. And it's not about having one bad day.
Right.
These symptoms have to be consistent for at least 2 weeks. For a diagnosis, for a mild episode, you might experience at least 2 of those initial symptoms. We talked about low mood, loss of interest, and fatigue, and at least 2 of the cognitive or emotional changes, like difficulty concentrating or low self-esteem.
So it's a combination of factors, not just
Yeah.
one single symptom.
Yeah.
What about moderate depression? How is that classified?
Similar criteria, but you'd experience at least 2 of those initial symptoms and at least 3 from that second set. The cognitive and emotional changes, it's essentially more symptoms,
Yeah.
possibly more intense.
And severe depression, I imagine that involves even more of these symptoms, including like thoughts of self-harm.
You're exactly right. For a severe episode, all 3 of those initial symptoms, plus at least 4 from the second set, need to be present for at least 2 weeks. And often, yes, severe cases include thoughts of self-harm or suicide,
Right.
requiring immediate intervention.
We touched on these difficult cases earlier, but I'm curious what makes them so complex.
There's this category called a severe depressive episode with psychotic symptoms.
Psychotic symptoms? What does that even mean?
In simple terms, it means experiencing things that aren't real,
Okay.
like hallucinations or delusions, in addition to the core symptoms of depression.
Got it.
This level of depression requires specialized intensive care.
So, a much more serious and complex situation. What about those times when the symptoms aren't super intense, but they linger for a long time?
That's where dysthymia comes in.
Okay.
It's this chronic, persistent form of depression, usually milder, but it lasts for at least 2 years. Imagine feeling low, lacking motivation, struggling with fatigue for years. It can be incredibly draining and debilitating, even if it doesn't reach the level of a severe episode.
It sounds exhausting.
It really is.
Yeah.
And that's why recognizing and treating dysthymia is so important, even if it doesn't have those really alarming severe symptoms.
So we've covered what depression is and how it's diagnosed. Now, these guidelines also talk about different levels of care: primary, secondary, and tertiary. Can you break down what those levels actually mean in practice?
Think of it as a tiered system
Okay.
to make sure people get the right support. Primary care is where it all might begin.
Right.
If you're experiencing mild depression
Yeah.
or dysthymia, your general practitioner could be your first point of contact.
Okay.
But even at this level, the guidelines say your doctor should have specialized training in mental health.
So not just any doctor,
Right.
but someone equipped to handle those initial stages.
Exactly. They can offer initial support, psychoeducation,
Yeah.
to help you understand your condition, and potentially even prescribe medication, if needed.
You mentioned medication. I remember those terms like tricyclic antidepressants and SSRIs in the guidelines. Do those come in at the primary care level?
They can, yeah.
Okay.
Your primary care physician might consider them, especially for mild to moderate depression.
Okay.
And remember, different medications work in different ways. Finding the right one for you is key.
Right. So it's not about just jumping to the strongest medication right away.
No, it's about finding the right fit.
Got it. What about therapy? Does that typically happen at the primary care level too?
It can, but it often plays a bigger role at the secondary care level,
Okay.
which involves seeing a specialist, like a psychiatrist
Okay.
or a dedicated mental health clinic.
So when would someone be referred to that secondary level?
If the depression is more severe,
Okay.
or if it hasn't responded to initial treatments,
Mhm.
or if it involves those complex factors we talked about, like suicidal thoughts or substance abuse, you'd likely be referred to a specialist. They have a wider range of tools.
So what kind of treatments are we talking about at the secondary level?
A broader array of psychotherapeutic approaches,
Mm-hmm.
more specialized medication management, and even hospitalization if needed.
Hospitalization, when would that be necessary?
If someone's at risk of harming themselves
Okay.
or others, or if their symptoms are so severe that they can't function in daily life,
Right.
a hospital provides a safe, structured environment for intensive treatment.
So it's about safety and getting the support they need to stabilize. And then there's the tertiary level. What does that involve?
Tertiary care is the highest level of specialized care,
Okay.
usually provided at a psychiatric hospital. These centers are equipped to handle the toughest cases.
Wow. So this is for really complex, maybe even treatment-resistant cases.
Exactly. They have access to a wide range of medications,
Yeah.
different forms of psychotherapy,
Mm-hmm.
and even things like electroconvulsive therapy, or ECT, in very specific situations.
Right, ECT. That can be kind of controversial, but I know it can be a life-saving option for some.
Yeah.
Yeah.
The decision to use ECT is never taken lightly,
Right.
and it's always done with informed consent
Mm-hmm.
from the patient.
It's really interesting how these guidelines create this tiered system. It's like making sure people are getting the right level of care from their family doctor to a specialized team, depending on their needs. What else is important to know about how these levels work?
The guidelines don't just outline the types of care.
Right.
They actually get into the resources needed at each level.
Okay.
Think of it like the equipment and expertise for different scenarios.
I like that.
At that primary care level, you need the essentials, the diagnostic manuals,
Yeah.
the ICD-10,
Right.
the DSM,
Mm-hmm.
to help with accurate diagnosis,
Yeah.
and a basic set of medications.
Okay, so the foundational tools.
Exactly.
Okay. Yeah.
Then you move up to secondary care.
Yeah.
The resources get more specialized.
Okay.
You might have a hospital bed for observation,
Yeah.
or short-term stays, a wider range of medications
Mhm.
to address different needs,
Yeah.
and a team with more in-depth training.
So a step up in expertise and interventions.
Right.
Okay.
And then tertiary. That's the most comprehensive,
Yeah.
more specialized beds. A provision for things like ECT,
Right.
and a multidisciplinary team, psychiatrists,
Yeah.
psychologists,
Mm-hmm.
nurses, social workers,
Mm-hmm.
all collaborating to address those complex cases.
So it highlights how it's not just one doctor.
It's a whole system,
It is, yeah.
making sure each level has the right tools and expertise.
Speaking of tools, let's talk about the medications. There's such a variety.
Here it is, yeah.
Tricyclic antidepressants, SSRIs, MAOIs. That's a lot.
It reflects the range of options available
Okay.
to manage different types and severities of depression.
Right.
Each medication works a bit differently,
Okay.
with its own potential benefits and side effects.
You mentioned SSRIs earlier. Why are they often preferred?
SSRIs, or selective serotonin reuptake inhibitors, they mainly target serotonin in the brain. This focused action can mean fewer side effects
Okay.
for some people compared to older antidepressants,
Yeah.
like tricyclics.
So it's about minimizing those unwanted effects while still treating the depression effectively.
Exactly. But remember, there's no one-size-fits-all when it comes to medication.
Right.
Everyone responds differently.
Yeah.
So it's about finding what works best for you
Okay.
in collaboration with your doctor.
So it's like finding the right key for a very specific lock.
That's a great analogy.
Okay, good.
And even when you find the right medication, the guidelines emphasize working closely with your doctor
Yeah.
to figure out the right dosage
Yeah.
and how long to take it.
So it's an ongoing conversation, not just a one-time prescription. What are some general guidelines, though, for how long people might take antidepressants?
It varies so much,
Right.
depending on the individual and their situation. But for a first episode of depression,
Okay.
medication is usually continued for at least 6 months after symptoms improve to reduce the risk of relapse. It's not about stopping as soon as you feel better,
Right.
but solidifying those gains.
So preventing that revolving door of depression coming back.
Exactly. And for people who have multiple episodes,
Yeah.
longer-term treatment might be recommended, sometimes even for years.
Okay.
It's about finding that balance
Yeah.
of effectiveness and well-being.
So long-term management, not just short-term relief.
Right.
Now, beyond medication, the guidelines also emphasize psychotherapy.
It's crucial.
Why is that so important?
While medication can address the biological side of depression,
Yeah.
therapy helps you develop the skills and insights to manage your condition long-term.
Hmm.
Think of it as equipping yourself with a toolbox
Yeah.
full of strategies for coping, for changing negative thinking, and building a more resilient mindset.
So it's about empowering yourself to navigate life's ups and downs, with or without medication.
Precise.
And the guidelines, they recommend some evidence-based therapies, right, that are proven effective for depression.
They do, yeah.
What are some of those?
One you've probably heard of is cognitive behavioral therapy, or CBT.
Yeah, CBT. I've heard of that.
It focuses on identifying and changing those negative thought patterns and behaviors
Okay.
that can contribute to depression.
So rewiring your thinking and actions, breaking those negative cycles.
Exactly. It's about learning to challenge those thoughts
Yeah.
and replace them with more balanced, helpful ones.
Are there other approaches that focus on different aspects?
Of course, the guidelines also recommend interpersonal therapy, or IPT,
Okay.
which focuses on improving your relationships and social skills.
Because relationships and belonging are so important.
They really are.
Yeah.
IPT helps you navigate conflicts, build healthier communication,
Right.
and develop a stronger support system. All of that can really impact your mood and resilience.
It's about strengthening those connections that nourish us. What about therapies that go deeper into the past?
The guidelines mention psychodynamic therapy,
Okay.
which explores how past experiences and unconscious conflicts
Right.
might be contributing to your depression. It's about understanding those deeper roots of your emotional patterns
Interesting.
and developing healthier ways of relating to yourself and others.
So there's a whole spectrum of therapeutic approaches,
There is.
each with its own focus.
Right. And it's about finding a therapist
Yeah.
and a type of therapy that really resonates with you.
Okay.
It's a collaborative journey,
Yeah.
working together to understand and overcome these challenges.
It's not a one-size-fits-all approach.
Yeah.
Just like medication.
Exactly. And remember, therapy is a process. It takes time and commitment, but the rewards can be incredible.
Now, we've talked about treatment generally, but the guidelines also highlight situations that makes things more complex. What are those factors that complicate treatment?
Well, they specifically mention suicidal ideation,
Okay.
substance abuse,
Yeah.
and comorbid conditions
Yeah.
as factors that can increase the complexity significantly.
Let's start with suicidal ideation. That's obviously very serious. What do the guidelines say about that?
They stress how important it is to assess for suicide risk in every single person presenting with depression.
Okay.
It's not something to shy away from, but a crucial part of ensuring safety and providing the right care.
So having those difficult conversations,
Yes.
not avoiding them, how does a healthcare provider actually assess for suicide risk?
It involves careful questioning
Right.
and observation,
Okay.
looking for signs,
Yeah.
like directly expressing thoughts of suicide,
Yeah.
talking about feeling hopeless, or even making plans for self-harm.
Right.
You have to be attentive to both what they're saying and their overall demeanor.
And if someone is deemed at risk?
Immediate intervention.
Okay.
That might mean hospitalization to keep them safe,
Yeah.
intensive psychotherapy to address those thoughts and feelings,
Mm-hmm.
and medication management to help stabilize their mood. It's about providing a safety net
Yeah.
and the support they need to navigate that crisis.
So recognizing the urgency and acting swiftly. What about substance abuse? How does that complicate things?
Unfortunately, substance abuse and depression often go together.
Right.
It can become a vicious cycle.
Yeah.
Someone might use substances to self-medicate, but in the long run,
Right.
it just makes their symptoms worse and makes treatment much more difficult.
So it's a temporary escape
Right.
that ultimately creates more problems.
Exactly. And it makes treatment more complex because you're not just dealing with the depression.
Yeah.
You're dealing with addiction, too. You need a specialized approach to tackle both issues simultaneously.
It's a double whammy.
Oh.
And what about comorbid conditions, the presence of other mental health issues?
When depression occurs alongside things like anxiety disorders
Right.
or personality disorders, treatment becomes like solving a multi-layered puzzle.
Okay.
You have these interacting issues that all need to be addressed holistically.
So it requires a more tailored approach, taking everything into account. Wow, these guidelines are really comprehensive. They offer guidance even for those more challenging situations. It speaks to the complexity of mental health care.
It does, yeah.
I want to learn more about what the guidelines say regarding depression in India specifically, like the prevalence and the cultural context.
It's important to understand those social and cultural dimensions.
Right.
How depression is experienced and perceived.
You mentioned before that the rates of depression in India are significant. What struck you about that information?
The guidelines acknowledge that official statistics likely underestimate the true prevalence.
Really?
Because of stigma and underreporting.
So the numbers might just be the tip of the iceberg.
Exactly. And this underscores how vital it is to address the stigma surrounding mental health. Create an environment where people feel comfortable seeking help without judgment or shame.
Because if people are afraid to even talk about it,
Right.
they're less likely to get the support they need.
Absolutely. The guidelines also highlight how cultural factors can influence how people experience and seek help for depression.
Can you give us some examples?
Well, in India, mental health issues are often viewed through a somatic lens.
Okay. What does that mean?
It means people might focus more on physical symptoms
Okay.
rather than emotional ones.
So instead of saying, I feel hopeless, they might talk about headaches or fatigue.
Exactly.
Interesting.
And healthcare providers need to be aware of this.
Right.
They need to be skilled at listening for those indirect expressions of distress and ask the right questions to uncover the underlying emotions.
So reading between the lines,
Yes.
understanding the cultural nuances, what else should providers be aware of in terms of cultural sensitivity?
The guidelines emphasize how important family and community are
Yeah.
in mental health care in India.
So it's not just about treating the individual,
Right.
but understanding their social network.
Exactly. Involving family can be incredibly beneficial. It provides support, understanding, a shared sense of responsibility. For recovery,
It's recognizing that mental health is not isolated. It exists within this web of relationships and cultural beliefs.
you're exactly right. These guidelines advocate for a culturally sensitive approach, one that considers all these factors to provide the most effective and compassionate care.
Now, do the guidelines offer specific advice on managing depression in different groups, like children or older adults?
They do, yeah.
Okay.
They address the unique challenges and considerations for treating depression in
Yeah.
children and adolescents,
Okay.
pregnant and postpartum women,
Right?
and older adults. Each group experiences depression differently, requiring a tailored approach.
Let's start with children and adolescents. How does depression look different in younger people?
Children and teens might not always express sadness or hopelessness directly.
Okay.
Instead, their depression might come out as irritability,
Okay.
anger outbursts,
Right.
behavioral problems.
So recognizing it's not just like typical teenage angst,
Right.
but could be something more.
Exactly.
Okay.
And the guidelines emphasize age-appropriate assessments and interventions. For younger children, this might involve play therapy or art therapy to help them express their emotions non-verbally. And with medication, the guidelines recommend a cautious approach for kids and teens with careful monitoring for potential side effects.
So prioritizing safety and minimizing risks. What about pregnant and postpartum women? That's a time of such hormonal and social changes.
It is, and the guidelines acknowledge those unique vulnerabilities. They prioritize non-pharmacological interventions whenever possible, like psychotherapy and support groups, to minimize potential risks to the baby.
So avoiding medication if possible,
Right.
to protect the baby.
Exactly. But in severe cases where medication is necessary, the guidelines provide guidance on choosing medications with a strong safety profile for both mother and baby.
That's a delicate balance.
It is.
The mother's mental health and the baby's well-being.
It requires careful collaboration between the provider, the mother, and her support system to make those tough decisions.
And older adults, what are the challenges there?
Older adults often experience more physical symptoms of depression,
Okay.
like fatigue, sleep problems,
Wow.
unexplained aches and pains.
Right.
These can be mistaken for other age-related health issues.
Oh, it's tricky to diagnose accurately.
It can be. You also have to consider potential interactions between antidepressants and other medications they might be taking. careful management is key.
Right, so more complex in terms of both diagnosis and treatment.
Yes, and the guidelines also highlight the need to address those psychosocial factors that can contribute to depression in older adults.
Okay, like what?
Things like social isolation, loss of independence, or grief and loss.
It's not just about their physical health,
Yeah.
but those social and emotional aspects.
It's about providing care that addresses all those dimensions of well-being.
It's incredible how tailored this advice is
It is.
across different ages and stages of life.
Right. The guidelines really highlight
Right.
that personalized care is essential.
Okay, so let's move on to differential diagnosis. What is that exactly?
This is where the detective work comes in.
Okay, I like it.
It's about carefully considering and ruling out other conditions. That might be mimicking depression. Because as we've said, depression isn't always clear-cut.
Right, so making sure you're treating the right problem,
Exactly.
not just assuming it's depression.
Right.
Based on a few symptoms. So what are some conditions that can look like depression?
One of the most common is anxiety disorders.
Oh, okay.
Anxiety can often occur with depression,
Yeah,
but it can also exist on its own
right.
and produce similar symptoms, like fatigue, trouble concentrating, and sleep problems.
So teasing those apart is important
It is.
to figure out if it's primarily anxiety or depression or both.
Exactly. Then there are physical health conditions
Okay.
that can mimic depression.
Like what?
Hypothyroidism, it can cause fatigue, weight gain, and low mood, all symptoms that overlap with depression.
So important to rule those out.
Right, through the thorough medical evaluation.
Okay.
And then there's substance use. As we discussed earlier, substance abuse can both trigger and worsen depression,
Yeah.
making it hard to tell which came first. So assessing for substance use is crucial during diagnosis.
Yeah, looking for those patterns and potential contributing factors.
Yeah.
What else should we be watching out for?
Well, neurological conditions,
Mhm.
like Parkinson's disease,
Yeah.
they can also cause mood changes and cognitive impairment that can resemble depression.
Interesting.
So sometimes a neurological evaluation is needed
Yeah.
to rule those things out.
So a lot of potential medical explanations to consider before diagnosing depression.
Exactly. And don't forget about nutritional deficiencies.
Right, right.
Even something like a vitamin B12 deficiency
Hmm.
can lead to fatigue, weakness, mood changes, things that can look like depression.
So addressing nutritional imbalances can be key.
It is. It's about taking a holistic approach.
Right.
Considering all the factors
Yeah.
that might be contributing to the person's distress.
It's a good reminder that mental health isn't separate from physical health.
Not at all.
It's all connected. Now, the guidelines also talk about specific tools and criteria to actually diagnose depression. We talked about the ICD-10, but are there other assessments?
There are, yeah.
Okay.
These help to gather more detailed information
Mm-hmm.
about the person's symptoms, the severity, and even track their progress over time.
So it's not just a gut feeling.
Yeah.
It's using these standardized tools for a more objective picture. What are some examples?
The guidelines mention a few. One is Beck's Depression Inventory, or the BDI.
Okay.
It's a self-report questionnaire.
Yeah.
The person rates how severe their symptoms are.
Okay.
That's a good tool for both assessment and tracking.
So it gives a snapshot of how they're feeling at that moment.
Yeah.
And how things change over time.
Right. There's also the Hamilton Depression Rating Scale, or HDRS.
Okay.
This one is clinician administered,
Okay.
meaning a healthcare professional asks questions and rates the severity
Yeah.
based on the person's responses.
Yeah.
It's a more comprehensive evaluation.
So more objective,
Yes,
based on clinical observation.
exactly. And then you also have psychological testing. That can play a role.
What kind of tests are we talking about?
The guidelines mention a few,
Yeah.
like the Bender-Gestalt test, the Minnesota Multiphasic Personality Inventory,
Mm-hmm.
and the Rorschach Ink Blot test.
Okay.
These tests can help assess for underlying personality traits, cognitive impairments, or other psychological factors.
So really getting a complete picture of the person.
Yes, understanding their unique psychological landscape.
It's like putting a puzzle together, huh?
It is.
Gathering info from different sources
Yeah.
to get that clear understanding.
Exactly.
Now, I'm guessing even with all these tests,
Yeah?
the good old-fashioned clinical interview is still a crucial part.
Oh, absolutely.
Okay, good.
The clinical interview is where the art of medicine really shines.
What do you mean?
It's more than just ticking boxes on a form, right?
Right.
It's about building rapport, truly listening to their story, understanding their experience
Yeah.
from their perspective, It's creating that safe space
Yeah.
where they feel comfortable sharing.
So that human connection,
Yes.
it's so important.
It is.
Not just seeing them as a case.
Right. And the information from that interview,
Yeah.
it's incredibly valuable. It guides the diagnosis, helps you understand the nuances of their situation, and really tailor the treatment plan.
It's a good reminder that healthcare is not just about science and technology. It's about that human connection and empathy. And these guidelines seem to really emphasize that.
They do. They recognize each person's journey with depression is unique, and treating them with respect, compassion, and understanding is crucial for their healing.
Well said. Now let's talk about putting these guidelines into action. Specifically in India, are there unique challenges and opportunities?
Absolutely. These guidelines offer a framework, but translating that into real-world practice, it comes with its own set of hurdles and possibilities.
Let's start with the challenges. What are some of the big ones?
One of the biggest is the shortage of mental health professionals in India.
I've heard about that. A huge gap between the need for services
Yeah.
and the availability of qualified providers.
It's a significant problem.
Yeah.
And it's even worse in rural areas.
Right.
Access to specialized care can be extremely limited.
So bridging that gap is crucial
It is.
to ensure everyone has access to the care they need.
Absolutely.
Yeah.
And then there's the stigma. We talked about it earlier.
Yeah.
The shame and discrimination surrounding mental health.
Right.
It can be a major barrier to seeking help.
Because if you're afraid to even admit you're struggling,
Right.
you're not going to reach out.
Exactly. And that delay can have serious consequences. We need to address that stigma. Create an environment where people feel supported, encouraged to seek help, not judged.
So changing those perceptions, creating a more open dialogue.
Yes. And we can't ignore the financial barriers. Mental health services, especially specialized care, can be expensive. Many people lack access to affordable insurance or government programs that cover it.
It's a huge problem. If you can't afford treatment, the guidelines don't mean much.
Exactly. Addressing those financial barriers is crucial.
It sounds like some big systemic challenges.
There are. But it's not all bad news. There are also some promising developments and opportunities.
Whoa, that's good to hear. What are some of the positive things happening?
There's a growing recognition of the importance of mental health at the government level.
Okay, that's good.
More funding allocated to services,
Mhm.
policy initiatives
Yeah,
to improve care. It's a step in the right direction.
it is. What about on the ground? Are there innovative approaches to actually delivering care?
Oh, absolutely.
Okay, like what?
Telepsychiatry
Okay, yeah.
is becoming more available, allowing people in remote areas to connect with mental health professionals
Right.
through video conferencing.
Yeah, technology can help bridge those gaps. What else?
And there are mobile mental health clinics that travel to underserved areas, bringing care directly to those communities.
Wow, that's amazing.
It is. And there's also a push to train non-specialist providers,
All right.
like primary care physicians,
Yeah.
nurses, in basic mental health care.
So expanding the workforce.
Exactly. Equipping those on the front lines to
Hmm.
recognize and manage those common conditions.
So empowering those already in the community
Right.
to provide that initial support.
It's a multifaceted approach
Mhm.
to tackling those systemic challenges and making mental health care more accessible.
It's inspiring to see these efforts. It shows that change is possible when we commit to it.
It does. It's about recognizing mental well-being as a fundamental human right and working together to make that a reality.
Now let's zoom out for a second and consider the bigger picture. It's not just about individual well-being, is it?
It's not. Mental health is woven into the fabric of society.
What do you mean?
When individuals get effective treatment for depression,
Yeah.
they see improvements, not just in their mood, but their relationships,
Yeah.
their work productivity,
Yeah.
their quality of life.
That's a chain reaction almost.
Exactly.
Those gains spread outward.
Yes, families experience less stress, workplaces see more productivity,
Yeah.
and communities benefit
Yeah.
from the contributions of healthier, happier individuals.
It's like investing in well-being pays off for everyone.
Exactly. A win-win.
These guidelines really highlight how interconnected we are, and that prioritizing mental health, it's not just a nice thing to do, it's essential
Absolutely.
for a thriving society.
It's a fundamental part of a healthy and productive society.
Now, before we move on, I want to mention something that stood out to me. The emphasis on patient education and empowerment.
So important. It's about moving away from that old model where the doctor dictates everything to a collaborative approach where patients are active participants in their own recovery.
So empowering individuals to take control of their mental health, not just following orders.
Yes. And that starts with education. When people understand their condition, what it is, what causes it,
Yeah.
the symptoms, the treatment options,
Right.
they're better equipped to make informed choices.
It's about demystifying mental health.
Exactly.
Mm-hmm.
Taking away that fear and uncertainty, that can prevent people from seeking help.
Knowledge is power.
It is.
And in mental health, it can be transformative. And it's not just about information, it's about fostering hope.
So important. Reminding people depression is treatable.
Right.
Recovery is possible.
Yeah.
You're not alone.
Because when you feel empowered and hopeful, you're more likely to engage in treatment and stick with it,
Yeah.
even when it's hard.
Exactly. It's about fueling that motivation, the belief that things can get better.
Well, we've covered a lot in this part of our deep dive. We've talked about managing depression in the long run,
Yeah.
the connection between mental and physical health, those ethical considerations, and the challenges and opportunities here in India.
It's been fascinating to see how individual well-being is tied to societal health and how these guidelines can help us navigate those complexities.
In our final part, we'll talk about some of the broader implications of these guidelines, explore alternative approaches, and leave you with some thought-provoking questions to ponder.
It'll be a great way to wrap up our exploration.
Welcome back for our final look at these depression treatment guidelines.
It's been a really insightful journey.
It has. We've learned so much about how depression is understood and treated, especially here in India.
It shows you just how complex mental health is.
It does. You can't separate it from the person's whole life, their surroundings, even how society views it.
Exactly.
And you mentioned something earlier, how treating depression effectively has these, ripple effects beyond the individual.
It does, yeah. When someone's able to manage their depression, it's not just about them. It affects their family, their work, even their community. Think about it. Someone struggling with depression, they may feel unable to contribute. But as they start to heal, they get their energy back.
Yeah.
They engage more in relationships. Maybe they return to work or pursue a passion. That change, it creates a ripple effect.
Like a pebble in a pond.
Exactly.
Like ripples spread out. So investing in mental health, isn't that really an investment in a healthier society as a whole?
I think so. And I think these guidelines support that. They focus on access to good care, reducing stigma, and empowering people to take charge of their own mental health.
It's about building a more resilient society.
Exactly.
One thing that's really stuck with me through this whole discussion is the importance of hope.
Hope is so crucial. It keeps us going when things are tough. With depression, it's that belief that recovery is possible, that things can get better, even when it's hard to see that right now.
These guidelines, they're technical, but I feel like they offer a path towards that hope. Would you agree?
I would. They give solid guidance for healthcare providers, but also a framework for understanding, managing, and overcoming depression.
Yeah.
They show the progress we've made in mental health care and this commitment to supporting people on their journey to well-being.
And each person's journey is unique, right?
Of course.
These guidelines really focus on that medical model, but we've talked about those other therapies too, the complementary and alternative ones.
Right.
What role do you think those play alongside the more traditional treatments?
I think they have a valuable place. Things like yoga, meditation, even just spending time in nature.
Yeah.
They can nurture our mental and emotional well-being.
Yeah.
They can go hand in hand with therapy, helping people manage stress, connect with themselves, find some peace.
Expanding the options.
It is.
Giving people more tools to find what works for them.
Exactly. It's part of this larger shift towards a more holistic view of health.
Right.
Recognizing that healing can happen in many ways, and everyone's path is different.
Well, we've come to the end of our deep dive. I'm feeling really inspired by these guidelines.
Me too.
They're more than just rules. They're like a call to action, a reminder that we all have a part to play in supporting mental health and creating a more compassionate and understanding world.
Absolutely.
Because when we understand something, that's the first step to healing and creating a healthier world.
It is.
Thank you for joining us on this incredible journey.
It's been my pleasure.
And remember, if you or someone you know is struggling, please reach out for help. There are resources, and recovery is possible.
Don't give up hope.
Until next time, keep learning, keep exploring and keep talking about mental health.